Dr. Fankhauser,
Yes.
are people still doing dentures, and should they still be doing dentures with all the implant possibilities? Dentures still something which should be done, and if people have dentures, should they replace them? Should they can't dentures be fixed once they get loose? Tell us all about it.
All right. Well, first of all, again, the obvious best thing to do is don't lose your teeth in the first place. Take good care of them so you can use them your whole life. But if you already have dentures or you have teeth that are beyond fixing, then maybe dentures is the best option for you. And as the population, the baby boomers are getting older, and there's been wear and tear over the years on the teeth, and people already have gum disease and are losing their teeth, and then there's been more of a demand for dentures now than there used to. I can remember in earlier days, I maybe did 5 dentures a whole year. Now we're doing a lot more than that. I don't know exactly how many, but here's the twist on it now is that, especially on the lower denture, if you wear a lower denture for many years, let's say you've had a lower denture for 20 years, you've probably lost a lot of bone. That lower denture doesn't stay put. It floats around in your mouth. You can't eat very well. There's a way to fix that denture now to the bone with implants so that you can chew like a normal person again. So that's something that's, it's been done for a few years, but it's becoming more and more routine, let's say.
See, so you're talking about a hybrid of, yes, you still have dentures for the whole mouth, basically, but there's 2 or 3 implants in it which grab those dentures and keep them in place.
Exactly. So they're not floating around. They don't jump up when you talk or sneeze, and you don't have to worry about losing something. Or I had a guy one time. He used to get drunk and he would lose his dentures in the toilet.
So what was the bad thing? That he was in the bathroom, or that he got drunk, or that he had dentures?
Well, who knows?
Where did the things start to be not right?
Yeah.
All right. Now, so let me ask you. So so you're doing dentures. What's one of the major disadvantages of dentures versus a major advantage of dentures? Which probably always is price versus implants. I mean, it gotta be a lot cheaper than doing a lot of implants. But what, are there some things with dentures which people should know about, the way it might be affecting their life?
Well, if you have teeth that are in very bad shape, let's say you have a lot of missing teeth, and if there was enough teeth, we might use a partial denture, but if you don't have enough teeth to really hold a partial denture, and things are not in good enough shape to keep in there and salvage, then sometimes clearing house or getting rid of all the teeth and making a denture makes better sense, because you can also have a nice new smile. I mean, we can make dentures look really nice because they are controlled. It's a controlled thing. We can make them look however we want. So they can look drop dead gorgeous, but adding the implants in underneath the dentures now makes them more secure, so they work better.
What about tasting food and food getting stuck between the palate and stuff? Is that with new types of dentures still a concern, or not really anymore?
Well, that's still going to be a concern unless you have implants holding the dentures off of the gum tissue, or where you can remove the part that covers your palate. You have to have implants in to do that. Or if you have on the lower, if you have implants that can hold an implant structure that can hold the denture off of the gums, so that, let's say you eat strawberries or poppy seeds or something, even if they got underneath there, they're not going to pinch.
Okay.
See?
Got it. I got it. What about when all your teeth are missing, any teeth for that much, that means the bones, the arches, the bones starting to lose. It's like, if you don't use it, it's basically a tooth with his root in it, keeps the bone from shrinking. And when all the bones are shrinking, the arches are shrinking, and then people start looking older because they start caving in. They start looking like a dried out tomato with those dentures. Is that really, is there something to it, or is that a whole different phenomenon?
Are you sure you're not a dentist?
Am I sure I'm not a dentist? I'm not.
Yeah. So, well, yes.
Next guy.
Absolutely. The reason that the bone is there is because the tooth was in it. So if you remove the teeth, then the bone wants to atrophy or disappear. It goes somewhere else in the body. And the longer you wear dentures on gums without any implant support, it's gradually making the bone loss worse. Every year you got a little bit less bone, and so sometimes people come in after wearing dentures for 30 years, and their jaw is about this thick. Where I can put that in there. They've only got about this thick a jawbone, and you could just break it by tapping on it. So
does a person start looking older when that happens? Older than he really is?
Absolutely. Absolutely. Yeah.
And can an implant or a row of implants, lots of them I suppose, can implants prevent that looking older versus a denture?
Yes. Well, does anybody know how old they are? So, there's a lot of things today that can make you look younger than you really are. Of course, we focus around here a little bit more, and but from here down, there's a lot could be done too. So, but implants in the mouth can help rejuvenate some things. And we didn't talk about dermal fillers or Botox and all that kind of stuff.
Well, that's a different ballgame. It's just like having all your teeth in it. Does it kind of like, having all your teeth in it and or replacing them with implants, which is, the body looks at it as like having your teeth in it. Does that preserve your facial expression, in a nicer, fuller way longer than it would be if all your teeth are missing?
Well, right. If you put an implant in the bone, it helps preserve the bone. Whether even if it's not a tooth, it's still an implant. It still works the same way. The bone will form around it.
Sure.
So
basically, a dentist, an implant dentist, putting implants in it and stuff could also be called a cosmetic surgeon because he makes you looking.
Well, yes, we do plastic surgery, but we're using the plastic in the dentures.
Right. Okay, good. So if a person today has any money problem and he got to go for the denture because they're less expensive, would it be wise for him to save up over a year or two and then able to get implants? Would that be overall for his basic able to function, feeling more confident and keep looking younger longer? Would that be an advisable thing to do?
Well, maybe. If the person is to the point where the teeth have to go, a lot of times what we do is go ahead, take the teeth out, make the dentures, wear them for maybe 6 months or a year, and then put the implants in.
That's my point. So, especially, for instance, if it is a financial situation that, like, yes, I want it, but, like, it would be a denture, a good bridge for a half a year, maybe even two, until the person can come up with the finances to get the implant, save up for it, get it going, and by doing so, it didn't yet get that totally loss of bone in that year or two.
Yeah, you just don't want to wait 20 years, but, if you go a couple of years, sure, then we can go back in, use the same dentures, put the implants underneath them.
Good. All right.
So that way you don't lose any, you're not backing up anyway.
Well, all right. Well, wonderful. Okay. Good. Well, that was it on dentures and implants and what it is all about. Thanks, Dr. Fankhauser.
All right. Thank you.